Committee will now come to order. Today we meet to report the recommendations submitted to the Budget Committee pursuant to the reconciliation instructions set forth in Title II of S.Con. Res. 11, the concurrent resolution on the budget for fiscal year 2016. Under the Congressional Budget Act of 1974, the Budget Committee has the role of combining the reconciliation submissions of the three instructed committees and reporting the bill to the House without any substantive revisions. After reporting the measure, the committee will follow its customary practice of considering motions to request changes to the reconciliation bill at the Rules Committee, which may make in order amendments to a reconciliation bill. Under the agreement I've reached with Ranking Member from Maryland, Mr. Van Hollen, the procedure for today's markup is as follows. First, the Ranking Member and I will each make an opening statement. Given time constraints with floor votes scheduled later today, I ask that members insert their written statement into the record. I will hold the record open until the end of the day for that purpose. After the opening statement, staff will be available for a 10-minute Q&A period, followed by up to 40 minutes of general debate on the reconciliation bill. We will then proceed with a motion to report to the House the recommendations submitted to us pursuant to the reconciliation instructions. After voting to report the Restoring Americans Healthcare Freedom Reconciliation Act of 2015, we will then debate up to two motions, one offered by the minority and one offered by the majority. For each motion, there will be a total of 20 minutes of debate. The proponent will be recognized for 8 minutes, and the member opposed will be recognized for 10. The proponent will then have 2 minutes to close. I now recognize the gentleman from Indiana, Mr. Rokita.
Thank you, Mr. Chairman. Since we are scheduled to have floor votes later today, I ask unanimous consent that, consistent with Clause 4 of House Rule 16, the chairman be authorized to declare recess at any time.
Without objection, so ordered. We'll now move to our opening statements. Again, I want to thank everybody for joining this markup today. We are reporting today a package of legislation submitted by the three House committees pursuant to the reconciliation instructions included in this year's concurrent balanced budget resolution. This is the next step in an ongoing process that will give Congress the opportunity to move legislation through both the House and the Senate in an expedited manner and to the President's desk for his consideration. This year, for the first time in over a decade, Congress passed a bicameral 10-year balanced budget. It's a pro-growth plan to promote job creation and economic opportunity, to hold Washington accountable, to make government more efficient and effective, to support key priorities like our national security as well as health and retirement security, and to get our fiscal house in order. Now, because the House and the Senate reached an agreement on the budget, we have the opportunity to pursue this reconciliation process. The fiscal year 16 budget resolution states that reconciliation ought to be used to address Obamacare in an effort to help all Americans gain access to the health care and coverage that they want, not that the government forces them to buy. And that's exactly what we're doing here today. We are committed to protecting every American from this harmful law and the damage that it has done and will do to patients, health care providers, family budgets, and job creators. Whether it's fewer health care choices, less access to care, higher out-of-pocket costs, or less medical innovation, Obamacare is an attack on quality health care in our nation. Last week, the three House committees charged with reconciliation instructions, the Ways and Means Committee, the Education and Workforce Committee, and the Energy and Commerce Committee, held their markups on their respective recommendations. And I want to thank Chairman Ryan and Chairman Klein and Chairman Upton for their hard work and the hard work of their committee members. This is a team effort, and they and their committees have shown real leadership in this endeavor. Under the reconciliation process, the role of the House Budget Committee is to combine the recommendations sent over from the three committees into a single bill and consider that single bill here in our committee before reporting it to the full House for its consideration. A quick review of the policies in this legislation demonstrates a concerted effort to provide relief to the American people from the damage inflicted by Obamacare while focusing resources where they can do the most good. The Ways and Means Committee has achieved $37.1 billion in savings by repealing the individual and the employer mandates, the so-called Cadillac tax, the medical device tax, as well as the Independent Payment Advisory Board, the 15 unelected, unaccountable bureaucrats who are empowered by Obamacare to make decisions that will effectively deny care to seniors. The Energy and Commerce Committee has achieved $12.4 billion in savings by repealing an Obamacare slush fund called the Prevention and Public Health Fund, and they've included an additional policy that would prevent for 1 year taxpayer dollars from being used to pay abortion providers prohibited in the legislation. This is accompanied by more money and more resources for hundreds of community health centers across this country so that women would have greater access to health care. The Education and Workforce Committees has achieved $7.9 billion in savings by repealing Obamacare's employer auto-enrollment for health insurance. When these three components are combined into one bill, the total savings is $79.8 billion. Together, this package will dismantle many of the key elements of Obamacare that are harming individuals and families, hurting job creation, and spending taxpayer dollars on programs with little to no congressional oversight. Our goal here is to save the country from this disastrous law and start over with patient-centered health care solutions where patients and families and doctors are making medical decisions, not Washington, D.C. Now, while it's the job of the Budget Committee to combine these recommendations, it is not within our power under the reconciliation process to make substantive changes to the legislation before us. As you see projected, Section 310 of the Budget Act states that each such committee so directed shall promptly make such determination and recommendations and submit such recommendations to the Committee on the Budget of its House, which upon receiving all such recommendations shall report to its House reconciliation legislation carrying out all such recommendations without any substantive revision. Therefore, today's markup may not include any amendments. There will be an opportunity for motions regarding process after the legislation is addressed. Again, I want to thank this committee and the committees who helped draft this legislation for their efforts, and I look forward to today's debate. And I now yield for his opening statement to the ranking member, Mr. Van Hollen.
Thank you, Mr. Chairman. It's absolutely mind-boggling that we're here on this day in this place with this piece of legislation in front of us. We all know that we have a crisis of leadership within the Republican caucus, and that may be just a matter of political intrigue to some, but the reality is it's causing harm to the country as we speak. We have a huge number of pressing issues facing our country right now. We have the threat of another government shutdown in mid-December. We've got our debt payments and debt ceiling that needs to be addressed so the United States makes good on the full faith and credit of the United States so we don't put our economy at great risk. We have a transportation authorization bill that expires within weeks. And yet here we are today for the 62nd time, by my count, trying to dismantle the Affordable Care Act, and on top of that, attack women's health programs, including Planned Parenthood. So rather than tackling those issues, here we are trying to do the bidding of a faction of this House that just can't come to terms with the fact that the Affordable Care Act is the law of the land and upheld twice by the Supreme Court. And it really is pretty outrageous that the focus now is on dismantling the Affordable Care Act. I draw my colleagues' attention to the Congressional Budget Office's analysis of this reconciliation bill. As everyone here knows, these are the nonpartisan experts. A new head of the CBO is there, appointed by this chairman and the chairman on the other side of the Capitol. And here's what the Congressional Budget Office reports this bill will do. It would reduce the number of non-elderly people in the United States with health insurance coverage by about 14 to 15 million in most years. About 20% of those are estimated to be children. I'd like to put up a chart. As you can see, the Affordable Care Act has had a dramatic impact in reducing the number of uninsured in this country. It is doing its intended job of providing affordable health care to another 16 million people, including children. And yet the priority of our Republican colleagues in this House at this time of dysfunction and pressing issues is to pass a piece of legislation that's going to take that health insurance away from 16 million Americans. It's astounding. And at the same time, we see an attack on women's health programs. I'd just like to put up another chart here. This House has had 3 committees investigating Planned Parenthood. This was the conclusion announced by Mr. Chavis, the chairman of the Oversight and Government Reform Committee, on national television the other day. Is there any evidence, in your opinion, that Planned Parenthood has broken any law? Answer, no, I'm not suggesting that they broke the law. Next chart, please. And in fact, at the hearing where that committee brought the head of Planned Parenthood in front of them for 4.5 hours, it wasn't a question of Planned Parenthood's wrongdoing. The chart that was put up to try and make the point by the Republican chairman of that committee was given the pants on fire rating, meaning the most untruthful statement that you can make by the nonpartisan PolitiFact. So here we are today with a piece of legislation designed to deprive 16 million Americans from affordable health care, designed to go after women's health programs and a witch hunt against an organization that provides cervical cancer screenings and other important preventive health measures for American women, and that seems to be the priority. Now, Mr. Chairman, you said this would actually help reduce the deficit. I also refer our colleagues to the CBO report, and just draw your attention right here to page 8. And what it says is that if you actually look at the long term, beyond our artificial 10-year windows, this legislation actually increases the deficit. So all this talk about balanced budgets is just nonsense. This actually increases our deficit over the period of time outside the 10-year window. And interestingly, I think the chairman mentioned that within the 10-year window it has the $79 billion of cuts, but of course those go away. That's just an artificial marker. And if I remember, the Republican budget had almost $4 trillion in cuts in mandatory spending. This is your one shot at reconciliation. Your one shot. And so you're just telling the world that you didn't mean it when you put forward that whole budget, because you're coming up with a piece of legislation that in the long run actually increases the deficit. It doesn't come close to balancing the budget. That was all smoke and mirrors. And you're doing it, though, at the expense of 16 million Americans who now have affordable health care, taking that away and launching an attack on women's health programs in an organization that the chairman of your own investigatory committee has said hasn't violated any laws, and by the way, himself put forward an argument that got him the most untruthful rating from nonpartisan PolitiFact. So I'm going to offer later a proposal to prevent the government shutdown. I hope we can all agree on that. We certainly don't agree on the idea of taking away health care from millions of Americans. Thank you, Mr. Chairman.
Thank you. Given the time constraints, I ask unanimous consent that members have until the end of the day to submit statements for the record. Without objection, so ordered. We will now take up to 10 minutes for staff to answer any technical questions about the Restoring Americans Healthcare Freedom Reconciliation Act of 2015. I urge members to ask factual questions if they have them. The staff is available to answer any technical questions regarding the recommendations, not to debate the policy implications of the recommendations. We have 10 minutes for this, and I ask if any folks, any members have any questions. A gentleman from Washington, Mr. McDermott.
Mr. Chairman, I will only ask one question. Did you leave in place the provision in the Affordable Care Act that requires insurance companies to issue insurance policies to anybody, no matter what their health care status is?
Ashley or Amanda? Staff?
Thank you for your question, sir. The legislation before you reflects the submissions of the 3 instructed committees per the FY16 concurrent budget resolution, and the language before you does not touch, I believe, the provision you're referring to.
You believe?
It does not.
It does not. Thank you. So it would require an insurance company to issue a policy to somebody. If they find out they're sick, they would go to the insurance company and say, I'm sick, I want an insurance policy. They would be required to issue it at that point.
Yes, Congressman, it does leave in place those provisions. It does leave in place those provisions.
Want to turn your mic on?
It does leave in place those provisions.
Thank you very much.
Other questions?
Yes, thank you,
And
Mr. Chairman. Well, it's the Budget Committee, so let me ask some questions that are clearly within the subject matter domain of this committee. Have you had a chance to review the Congressional Budget Office analysis of this budget this reconciliation legislation?
Yes, Congressman, we've had a chance to review.
Thank you. And is it the case that they concluded that this legislation will increase the federal deficit beyond the 10-year window?
I believe the submission that you're referring to from CBO analyzes the Ways and Means reported language to the House Budget Committee. According to the Budget Control Act, the House Budget Committee determines whether an authorizing committee is in compliance with its reconciliation directives and relies on CBO's estimates. Overall, the Ways and Means submission does reduce the deficit by $37.1 billion over the 2016 to 25 period.
No, but I'm sorry, that I understand that, but they also focused on, I think, what we should all care about, which is, not the deficit within an artificial window, but what's the long-term impact? And I'm just asking a question. This is the Budget Committee. We got something.
The gentleman has the CBO report. And
Yeah. But I don't think, there have been a lot of other things going on in the House recently. I do think it's important before we vote on this that we get, the analysts from the Budget Committee staff to just tell us what's in the Congressional Budget Office report. I'm not sure everybody here.
I can address your question, sir.
Thank you.
According to CBO, it says that the legislation would not increase the net direct spending by more than $5 billion in either of the first two consecutive 10-year periods beginning in 2026. However, the agencies, that is CBO and JCT, are not able to determine whether enacting the legislation would increase net direct spending in the third or fourth 10-year period. The agencies estimate that enacting the legislation would increase on-budget deficits by at least $5 billion in each of the 4 consecutive 10-year periods beginning in 2026.
Okay. And see, in fact, I hadn't myself seen that particular fine print, but I think it makes the point very clearly that, despite comments about, trying to balance the budget, that this, in fact, makes the budget deficit worse. I just think it's important that people understand that that's what they're doing here in the Budget Committee. Could you, we're in the budgets, the budget that passed the House, do you recall how many trillions of dollars in mandatory spending cuts it had?
With respect, I'm not certain that's a technical question about this reconciliation bill. If you want to carry on that line of conversation during the debate, then I think that's appropriate.
Well, again, Mr. Chairman, I was just referencing your comments that you made in your opening statement about this, your balanced budget, and I do think it's important to point out that your balanced budget required, I think, close to $4 trillion in mandatory cuts, and this has $79 billion, and that's in the 10-year window, which, as I said, it actually increases, not as I said, as CBO said, beyond that period, actually increases the deficit. So we can move on from there, but let's understand the factual impact of this legislation as well. In terms of the impact on some of the children's access to affordable care. Do you have any information that indicates how many kids who today have affordable health care coverage will no longer have that if this legislation passes?
Sir, CBO has not analyzed or provided us with the information on the aggregate totals with regard to the legislation as submitted by the committees.
You're referring now to the fact that they haven't just looked, you have the Ways and Means analysis, but not the analysis from other committees. Is that what you're
referring to? The package as a whole,
right.
Not further analysis that you're asking about.
Do you know if the impact from committees other than Ways and Means would have any impact on the children's health, affordability, access to affordable health care?
We're not prepared to answer those questions at this moment.
Well,
the impacts of the
okay, let me ask you this
legislation.
question.
We would refer you back to the CBO estimates regarding the recommendations that each of the committees submitted to the House Committee on the Budget.
Okay. Well, just for the benefit of the committee.
During this technical question time period.
Yeah, but during this technical question period, what could you tell us what CBO concluded with respect to the impact of the Ways and Means Committee portion of this bill on kids' access to affordable health care?
I think that's a debate point. And look, I respect
I'm
your
not debating,
position-
I'm just
your
asking. It's
position.
a factual question, Mr. Chairman.
It's not a technical question about the piece of legislation.
It is a technical question. I'm
No.
trying to figure out what the impact of the legislation is. Just a fact, it's a factual question,
And which is appropriate during the period of debate.
but we're asking now the analysts as to what the factual impact will be. Mr. Chairman, you know, we typically have, I think, at least half an hour to ask questions about the bill. We thought, in the interest of time, we wouldn't do that, but I'm not sure. I'm asking about a congressional, this is the Budget Committee, I'm asking about a Congressional Budget Office finding with respect to the impact of this legislation.
Do either of you have any further information to respond to that question?
We would just refer you to the CBO estimate on the Ways and Means Committee submission. It does, in fact, include some information about the effects of the repeal of the individual mandate, but it does not provide any specific numbers as to the number of individuals who would be losing coverage or who those
Amanda, you want to
individuals
pull your
might be.
microphone closer, please?
Of course. Again, I would refer you to the CBO estimate on the Ways and Means Committee submission regarding the repeal of the individual mandate. It does not provide any specific numbers as far as I can see at the moment, and would again ask you to look further at that submission from CBO and JCT.
All right, well, Mr. Chairman, I'll wrap this up unless any of my colleagues have any questions, but I must be looking at a different Congressional Budget Office report, because it does have numbers, and it says it would reduce the number of non-elderly people in the United States with health insurance coverage by about 14 to 15 million in most years, about 20% of those 14 to 15 million being children. So those look like real numbers to me, Mr. Chairman, but unless any of my colleagues have more questions, we can proceed to the next
Great.
matter. Thank you.
Thank you. Thank you very much. Thank you, staff, for your participation here today. We'll begin the, this concludes that question and answer period. Pursuant to my agreement with Mr. Van Hollen, I ask unanimous consent the general debate consists of 40 minutes, equally divided between the majority and the minority. Majority and the minority each have 20 minutes for general debate. Without objection, so ordered. We will, the majority side will now take 20 minutes, and then the minority side will then have 20 minutes to discuss the bill. I want to make a couple points before I yield to some of my colleagues. This piece of legislation is not in is in a vacuum. You can't do policy changes in a reconciliation bill. So to stipulate that there are this number of folks or that number of folks, that's looking at this legislation not in the context of appropriate reform. In fact, what we believe ought to occur is to have real reform, patient-centered reform, where patients and families and doctors are making these decisions and not Washington, D.C. It's important to point out that the American people, in a significant majority, continue to oppose this law. And they do so because it violates the principles of health care. Violates the principles of health care. Not that Republicans hold, not that Democrats hold, that the vast majority of the American people hold. And those principles are, we want a system, the American people want a system that's accessible for everybody, that's affordable for everybody, that's of the highest quality, that provides a system that's responsive to patients, that incentivizes innovation so we continue to have the highest quality health care in the world, and that provides patient choices. Patients ought to be the ones that are selecting when they're treated, how they're treated, where, and the like. And instead, this law puts government in charge of those things. So this is why we're bringing this forward. We believe so strongly that the American people ought to be positively and aggressively and actively represented by this Congress to respond to their concerns about this piece of legislation. So that's what this does. And the difference this time than in other times is that through the reconciliation process, we have an opportunity to have the Senate actually get to the legislation without the filibustering that occurs from our Democrat colleagues on the Senate side, and get a piece of legislation to the President's desk. So very positive activity that's going on here today, and I encourage our members to continue to move this forward. I now yield 2 minutes to the gentleman from Indiana, the Vice Chair of the committee, Mr. Rokita.
Thank you, Mr. Chairman. And good morning, everyone. You know, 6 years ago, Congress passed the Affordable Care Act, otherwise known as Obamacare, under the guise of increasing access to care. Now, today it is clear that Obamacare has been bad for families, bad for small businesses, and bad for our economy. You know, our debt continues to climb, and our economy struggles to recover under this administration. We need legislation that will provide jobs and opportunity for all Americans while not placing burdens on future generations, and that's the key. This law continues to impose onerous taxes on families and job creators. According to calculations by the Senate Budget Committee, Obamacare will cost future generations $6.2 trillion over the next 75 years. Obamacare will cost future generations $6.2 trillion over the next 75 years. We have a moral obligation not to pass this on to our children and grandchildren. Obamacare has also negatively impacted our economy. It imposes mandates that will burden employers and rob them of their ability to have the flexibility and choices needed to grow their businesses and respond to the needs of their employees. According to the Congressional Budget Office, Obamacare will actually cause 2.5 million employees to drop out of the labor market. That's not Todd Rokita's office, that's the Congressional Budget Office. Obamacare will actually cause 2.5 million employees to drop out of the labor market. It also created hundreds of rules forcing businesses to spend thousands of man-hours complying with new Washington regulations. We should instead look at how we can free up businesses and promote growth and innovation. This bill will help reduce our deficit by over $79 billion over the next 10 years and set us on a path towards a healthcare system that favors cutting costs and higher taxes. And of course, it will create jobs. Republicans in our budget and in this reconciliation process are supporting greater economic freedom and opportunity and supporting families and job creators. I yield back.
Thank you. I now yield 1 minute to the gentleman from New Jersey, Mr. Garrett.
I thank the chairman. You know, there is bipartisan agreement that the medical device tax must go. The House representative voted to repeal it back in the 114th Congress, the 113th Congress, and the 112th Congress. You know, traditionally, excise taxes are reserved for sales on sin products such as alcohol and tobacco. But the ACA, however, imposed an excise tax now on manufacturing of life-saving and life-improving devices. Additionally, there's a tax on sales. It's not on profits, and therefore it hits small startup medical device firms and innovators disproportionately. So in the search for taxes to offset the massive cost imposed by Obamacare, supporters of the ACA came up with a medical device tax that basically holds back growth and innovation in healthcare. The tax resulted in employment reductions, that's lost jobs, 14,000 industry workers last year, and years prior implementation of the tax with approximately additional 4,500 jobs in 2014, according to industry trade groups. Additionally, the industry will forego hiring a new 20,000 employees over the next 5 years. Considering both jobs lost and jobs not created, the tax will result in 39,000 fewer industry jobs. Simply put, the medical device tax puts efforts to innovate the next generation of life-saving technology at risk, and therefore I encourage members from both sides of the aisle to support its repeal.
Thank you. Yield 1 minute to the gentleman from Florida, Mr. Diaz-Balart.
Thank you, Mr. Chairman. Under the President's health care law, the Independent Payment Advisory Board was created. This board gives 15 unelected, unaccountable bureaucrats, super bureaucrats, a mandate to slash seniors' access to care and actually forces providers to stop seeing Medicare patients. The House passed legislation this year, by the way, with bipartisan support, repealing this board by a rather large margin. You see, both in the House, both Republicans and Democrats agree that allowing a panel of bureaucrats in Washington to make these kind of critical health care decisions, instead of allowing patients and their families to make those decisions, is not the right way to keep our promises to America's seniors. For those reasons and many others, this reconciliation package will repeal that board of super unaccountable bureaucrats. I yield back, Mr. Chairman.
Thank you. Pleased to yield 1 minute to the gentleman from Oklahoma, Mr. Cole.
Thank you, Mr. Chairman, for yielding the time. I want to focus on part of the reconciliation package that actually enjoys strong bipartisan support, repeal of the 40% excise tax on health care plans that are deemed to be too generous. This tax, due to take effect in 2018, would include plans which provide benefits above $10,200 for individuals or $27,500 for families. A recent survey by Mercer anticipates 1/3 of the employers would face this tax in 2018. By 2022, the number grows to 60%. The tax leads to less generous coverage by employers, which in turn leads to higher costs for employees in the form of higher deductibles and copays, the exact opposite of what the Affordable Health Care Plan was supposed to accomplish. Republicans have a bill to repeal this tax with 106 co-sponsors. Democrats have a a bill to repeal this tax with 143 Democratic co-sponsors. Even Democratic presidential candidate Hillary Clinton supports repealing this tax. So I would encourage my colleagues to support this sensible provision, which only serves to provide consumers with inferior health care at higher prices.
Thank the gentleman. Yield 1 minute to the gentleman from California, Mr. McClintock.
Thank you, Mr. Chairman. The reconciliation process is a powerful tool that's intended to enact the statutory changes necessary to implement the Budget Act, and I share the ranking member's disappointment that it doesn't implement the entire budget, and I'm glad that he's disappointed that we're not implementing the entire budget. I think that's a huge, huge improvement and real progress. But baby steps are better than no steps. And the reconciliation bill repeals Obamacare and its individual mandate. That's a good thing, and it's a good reason to support the Reconciliation Act. This mandate coerces healthy young people into paying exorbitant premiums to underwrite the expenses of older and sicker patients. We force a young person to pay much more than they should for their insurance so that others pay much less, and if they don't pay that exorbitant premium, we tax them to death, while of course still requiring that they pay back their government student loans. Repealing this mandate means reducing the tax burden on young families by $43 billion over the next 10 years. That's a good thing to do on policy grounds.
Thank the gentleman. Please yield 2 minutes to the gentlelady from Tennessee, Ms. Black.
Thank you, Mr. Chairman. I'm pleased to speak briefly today on a provision in this reconciliation package that is very dear to my heart, and that is the language placing a one-year moratorium on the payments to prohibited entities such as Planned Parenthood. Now, I know that some of my colleagues across the aisle have so far refused to watch these undercover videos implicating Planned Parenthood in the trafficking of fetal tissue. And perhaps they haven't seen this independent forensic report confirming the authenticity, but I have. And I believe that by not offering a response, we in Congress will be shirking our duties the people have sent us here to represent. And that is why this reconciliation package places a one-year moratorium on the funding to select abortion providers like Planned Parenthood, and instead redirects those dollars to more than 13,500 community health centers across this country. As you may know, I'm a registered nurse, and I wouldn't support legislation that would block access to preventative care. So my colleagues should know that this measure actually increases the funding for community health centers by $235 million. As members of this committee know, I'm unapologetically pro-life, but all of us should want to do everything in our power to ensure that the taxpayer dollars are spent with integrity and not doled out to entities that skirt the laws. This is not a political statement. This is quite literally our job here in Congress and on this committee in particular. We have a real and legitimate questions about potential illegal activities in Planned Parenthood. Until those questions are answered, and it is fully appropriate to call a timeout on taxpayer funding and to spend that money to send that money to federally qualified providers that offer a better standard of care to women who need it the most. And that is exactly what this provision in the reconciliation package will accomplish. And I urge this committee to prioritize women's health over the interests of a scandal-ridden, politically aligned abortion giant, and to support the reconciliation bill with the language included. Thank you, and I yield back my time.
Thank the gentlelady. Please to yield 2 minutes to the other gentlelady from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. And first, I want to commend Ms. Black for her excellent work on this issue. And let me start right where she left off, talking about these community health centers, because this is not a reduction in funds. This is a repositioning of funds. And quite frankly, it puts the money where people need it to deliver the care when it comes to women's health. It really gets to addressing the issue of access. We talk a lot about access and having the services where people need the services. And I think it's so important to note that for every one Planned Parenthood center that is in the country, there are 13 community health centers. And you take a district like mine, there is no Planned Parenthood facility, and you've got 16 of the community health centers. So it gives you an idea of the breadth and the expansion of access when you're looking at about 10,000 of these community health centers around the country. Also, our community health centers, with the increase as Planned Parenthood reduced their services through the years, and community health centers have seen the increase. They see 21.1 million patients each and every year, and that's 8 times the number that is seen by Planned Parenthood. So this is a repositioning of those funds to the centers where the money is going to meet the greatest need and do the most good. Now, the other provision that Ms. Black mentioned is the investigation that is going on. And yes, indeed, it's important to realize Planned Parenthood is a not-for-profit. They're not a federal agency. They're a not-for-profit. Any not-for-profit that had increased their request but also had decreased or cut in half their services over the last 7 years, which is what Planned Parenthood has done. We would call them in and want to know what they're doing with the funds. They're getting about $500 million taxpayer dollars a year, so yes. It's important that we do the review, and while they are under review, that we make certain that the funds are not going to them, and with that, I yield back.
I thank the gentlelady. Gentleman from South Carolina is recognized for 1 minute.
America used to be known as the land of opportunity. Now not so much. With the employer mandate and the other mandates under the Affordable Care Act, you can see that President Barack Obama has issued in his 6 years more regulations and mandates than any president since Lyndon Johnson. He's at 120,000 mandates and regulations. Next slide, please. Folks trying to get to the middle class and living on the edge under the Affordable Care Act, they can get free government health insurance. Of course, it might be an insurance policy they can't use because of the high deductibles, but they can get free government health insurance. The problem is that they can't get a job, because if you look at all these mandates and regulations and you see the effect on this slide, for the last 5 years, business startups have been outpaced by business closings for the first time in 80 years. You think all these regulations don't matter? Look at the facts. Look at the slide. More businesses are closing than being formed in this country. Yeah, they might be able to get free government health insurance. Of course, insurance they usually can't use, but they can't get a job.
I thank the gentleman. Gentleman from Indiana, Mr. Stutzman, is recognized for 1 minute.
Thank you, Mr. Chairman. As a sitting U.S. representative of Warsaw, Indiana, which is known as the orthopedic capital of the world, the burdensome medical device tax hits really close to home for me and for those of us in Indiana. In fact, Indiana as a whole is the second in the nation in exports of life science products, and across the state, over 20,000 Hoosiers are directly employed by the medical device industry alone. Companies like Zimmer Biomet, DePuy, and Cook Medical in Indiana are developing life-changing and life-saving innovations for our country and for the world. The impact on our communities and our neighbors is one of the reasons I fought so hard to repeal this destructive tax on the joints, knees, hips that increases patients' quality of life. The hardworking Hoosiers in my state know that taxation does not create jobs. It kills them. In fact, a recent study has shown that the medical device tax has cost more than 33,000 jobs nationally so far. Repealing Obamacare, and importantly, the medical device tax, is a common sense reform, and I urge my colleagues to support this very important legislation.
Thank the gentleman. Please yield 1 minute to the gentleman from Virginia, Mr. Brandt.
Thank you, Mr. Chairman. The reconciliation proposal approved by the Education and Workforce Committee would repeal Section 1511 of Obamacare, known as the auto-enrollment mandate. This mandate requires, that's the key word, employers with 200 or more full-time employees to automatically enroll new full-time employees into employer-sponsored health care coverage if the employee fails to choose another employer plan or decline coverage. Concerns have been raised that the mandate will create unnecessary confusion for workers and employers and result in penalties for those already enrolled in health insurance coverage. For example, if a veteran is hired and is insured under TRICARE, this mandate would force his employer to enroll him in duplicative and costly health care, deducting money from his hard-earned paycheck to pay for potentially worse coverage than he or she already has. Force, coercion, top-down. That is Obamacare. No freedom or free markets here. By eliminating this provision, we can help rein in our deficits and debt and roll back a harmful provision in the President's health care law. I find it a bit ironic that the ranking member is so concerned with deficits and debt when we are approaching $420 billion deficit this year, debt of $19 trillion, and the other side has not made one proposal since I've been here for the last year to rein in those issues. These are important priorities for the American people, and we can achieve both by repealing an Obamacare mandate known as auto-enrollment. Thank you, and I yield back, Mr. Chairman.
Thank the gentleman. Please to yield 1 minute to the gentleman from Arkansas, Mr. Westerman.
Thank you, Mr. Chairman. This budget repeals the Prevention and Public Health Fund. This fund is quite simply just a slush fund. It's an example of a slush fund created by Obamacare that funnels billions of dollars automatically, and the fund never expires. Under current law, the administration receives $1 billion per year with little oversight. So what does this administration do with a $1 billion per year slush fund? You might think they would give it to CDC to use it to work on early detection, prevention, and treatment for breast and cervical cancer. They might use it on immunizations, flu vaccines, or many other useful and worthy efforts. But no, they use this fund according to what the Committee on Energy and Commerce has uncovered. They've used it to promote pickleball, free pet neutering, and for massage therapy, kickboxing, and Zumba. They've also, congressional investigators have linked the use of the fund to questionable lobbying activities by the administration. And if that wasn't enough, the CDC was allocated taxpayer dollars to award grants for wellness efforts, but these funds were used to run ads attacking and singling out legal American products and industries, which the administration claimed contributed to bad health. Mr. Chairman, no government agency should receive American taxpayer dollars to advertise against American-made products, and I yield back.
I thank the gentleman, and I thank my colleagues for pointing out the remarkable challenges that the American people are having now with this law, and that's why we gather today in this reconciliation process to be able to put forward a piece of legislation that recognizes and respects the principles of health care. The current law makes health care less affordable for the American people. The current law makes health care less accessible for the American people. The current law harms the quality of health care for the American people. The current law decreases innovation in the health care arena, thereby decreasing further the quality of care being provided to the American people. And the current law destroys choices that are so necessary for patients and for families and doctors, those individuals that ought to be in charge of health care, not our federal government. So I commend my colleagues for their observations and appreciate their support for this piece of legislation. And that concludes the majority general debate time. I now yield 20 minutes to the ranking member, Mr. Van Hollen, and ask unanimous consent that he be authorized to yield such time without objection. So ordered.
Thank you, Mr. Chairman. Just interested in your characterization. Probably a majority of the members of this committee get their health care through the Affordable Care Act and go on exchanges, and I haven't noticed the government telling me what plan to get. And, you know, I would hope we would extend access to affordable care to the 16 million Americans who now have it who didn't. With that, I yield 2.5 minutes to Mr. Yarmouth.
Thank you very much, Mr. Van Hollen, and I'm glad that the chairman mentioned that, because this is getting to be kind of a Groundhog Day debate, and the good thing about Groundhog Day debates is you don't have to prepare for them. You've done them so many times. So I'm happy to repeat the impact of the Affordable Care Act on the Commonwealth of Kentucky. Under the ACA in Kentucky, more than 520,000 individuals have acquired coverage, which they didn't have before. As a matter of fact, we have reduced the uninsured rate in Kentucky by more than 50%, one of the best impacts in the country. In my district, in Louisville, Kentucky, Kentucky 3, we've reduced the uninsured rate by 81%. There are now fewer than 20,000 people in my district without health insurance. That's a phenomenal record. More importantly than that, well, maybe not more importantly, but equally important, is the governor of Kentucky, Steve Beshear, asked the Deloitte accounting firm to do a study of what the impact of the ACA would be on Kentucky between 2015 and 2020. They came back and said the ACA in Kentucky would create 42,000 new jobs, $38 billion in increased economic activity, and would have a positive impact on the Kentucky state budget of $820 million. So the ACA is working in Kentucky. It's working many places throughout this country, and to take the 60-something attempt to repeal and not replace, just repeal, would be a tragedy for this country, definitely a tragedy for the Commonwealth of Kentucky. I yield back.
Mr. Chairman, I yield 2.5 minutes to Mr. Pasquale, New Jersey.
Thank you, Mr. Ranking Member, Mr. Chairman. Under the Affordable Care Act, which has occupied 3/4 of our conversation so far, even though we're talking about the total budget, but I guess that's immaterial. Under the ACA, children can no longer be denied coverage because of a pre-existing condition. The ACA expanded coverage for kids aging out of foster care. It allows children to receive oral and vision coverage as a part of their benefit plans. This is what you're trying to take away. This is only one issue concerning the ACA, just one issue. So you can pontificate all you want about what this costs and what that costs. What is your plan? What is your idea of addressing just one part of what this legislation deals with? You have no plan. Because you think that that should be done either in the private sector or you think that should be done with people's income, even those who cannot afford it. So I urge my colleagues, focus on the funding, the government, funding this government, and the priorities that the American people care about. You know, when the President introduced his budget in February, he said something very interesting, and I want to close on this point, Mr. Chairman. There's a lot of things to talk about, but he talked about reversing mindless austerity. I think of Europe recuperating from their financial problems. Returning to the mindless austerity of sequestration in 2016 would bring discretionary funding to its lowest level adjusted for inflation since 2006. The budget proposes to end sequestration, fully reversing it for domestic priorities in 2016. That is the President's budget, not your budget. Matched by equal dollar increases for program integrity measures, for common sense loophole closures, including targeted reforms to crop insurance programs, program integrity investments across a range of programs, and closing the carried interest loophole, which we've been talking about since 2006. And I yield back, Mr. Chairman. I'm really getting tired to hear this redo every time we meet.
Mr. Chairman, I yield 2.5 minutes to Mr. McDermott.
Thank you. Mr. Chairman, I ask unanimous consent that the article I've distributed to the committee from the Seattle Times from the 28th of March, Why Washington State Health Reform After Loss of Mandates, be inserted in the record.
Without objection.
Mr. Chairman, this markup reminds me of George Santayana's aphorism that those who cannot remember the past are doomed to repeat it. Unlike many of the Affordable Care Act repeal bills that we voted on over the past few years, this one is only partially dismantling of the law. Most importantly, it leaves in place the guaranteed issue, which requires insurers to cover all Americans regardless of their health status. While it keeps in place this most important consumer protection, it also repeals the individually shared responsibility provision, which mandates that all Americans maintain minimal essential coverage. I can't help but wonder if the Republican colleagues checked with the insurance companies before they thought of this idea. Because if they had, they would have heard in no uncertain terms that this is a recipe for disaster. I know this firsthand because of what happened in my home state of Washington. In 1993, when the Washington State Legislature enacted an ambitious health care reform program that closely resembled the Affordable Care Act. It included strong consumer protections, such as a ban on medical underwriting and guaranteed issue requirements for all insurance companies. These provisions were paired with mandates that included individual purchase coverage and that business cover their employees. This created a delicate balance that ensured that consumers were protected from abuses by the health insurance industry and that the industry could spread risk broadly across entire populations. But when the Republicans took over the legislature in 1994, they repealed the individual mandate, which we're doing today, while leaving in place the popular consumer protections, including guaranteed issue, which we're doing today. This led to a statewide catastrophe. Without the individual mandate, consumers had no economic incentive to enroll when they were healthy. Instead, they would simply wait until they needed care to buy coverage. This led to a death spiral in the insurance industry. Across the state, premiums skyrocketed, fewer and fewer companies offered policies, and by 1999, the individual insurance market was dead. You could not buy a policy. Washington learned the lesson the hard way. You simply cannot require insurance companies to cover people without an individual mandate. But the reconciliation bill we're doing ignores this fact. All of us know that this will never become law, what we're doing here today. And in the future, I would encourage my Republican colleagues to look to history before wasting any more time on bad bills like this one. I yield back the balance of my time.
Thank you, Mr. Chairman. I yield 2.5 minutes to Ms. Lee of California.
Thank you very much. Thank you very much for yielding and for your tremendous leadership on this committee. Judging by this reconciliation bill, it seems once again that our Republican colleagues failed to realize that the American people do not want to shut down government over women's health. Yet they once again put forth legislation that attacks women's health and the Affordable Care Act. This reconciliation bill once again would defund Planned Parenthood for 1 year, preventing millions of women from accessing critical health services such as cancer and STI screenings and contraceptive care. It would also prevent states from receiving or using federal funds to reimburse certain providers simply because they provide abortion services as part of their practice, even if those services are provided outside of their participation in the federal health care program. That's outside of their participation. This means that federal payments under programs like Medicaid and the Maternal and Child Health Services Block Grant would immediately be disrupted, leaving countless low-income women and women of color out in the cold. These family planning programs are critical to reducing unintended pregnancies, and they make economic sense too. For every $1 spent on family planning services, we save more than $7 in other costs. The claim that our Republican colleagues that these women can simply go to other community health centers that receive funding in this reconciliation bill, that claim has not been discredited. This has been discredited by public health officials. It's just downright false. We would be sending women to providers who we know would not have the capacity to meet the need created by eliminating funding for family planning and other women's health care providers. Although Planned Parenthood centers make up only 10% of all publicly funded planning centers, family planning centers, they serve 36% of clients who obtain care from the Family Planning Center network. We know that Planned Parenthood centers are essential to the health and well-being of women and their families. In 2013 alone, Planned Parenthood provided health care services to more than 800,000 Californians in my home state and provided more than 93,000 Pap tests and 97,000 breast exams. Denying access to health care providers such as Planned Parenthood and other social safety net providers will hurt women who need these services the most. Again, low-income women and women of color. So we need to call this reconciliation bill what it is, yet another ideological attack on women's health. You won't support comprehensive sex education. You won't support family planning. You won't support contraception. And you don't support a woman's right to a safe and legal abortion. What do you support for women? Instead of continuing to undermine women's health care and access to a full range of reproductive health services, we should be working to replace this damaging sequester and work toward a responsible long-term budget deal. So I urge our colleagues to reject this underlying bill, and I yield back the balance of my time.
Thank you. I now yield 2.5 minutes to Mr. Pocan.
Thank you very much for that time. You know, a lot of us are going to be going home today. One of the things that I look forward to is going home and seeing my dog. I think I have a picture. There he is, right there. That's one of his favorite toys. He's got that canine single-minded obsession with returning that toy to me every time I throw it. No matter how wet it gets, no matter how chewed up it gets, he will return it. It seems like just about no matter how many times I throw it. But even he wouldn't probably bring that back to me on the 61st or 62nd time, because he knows that at that point it's pointless. And the bill we have before us is exactly that. It's pointless. It's never going to become law, but it does show the priorities, unfortunately, of the majority party. That you would increase the number of uninsured people if you repealed the Affordable Care Act, and you'd likely raise premiums. You'll take away the ability to not have pre-existing conditions and all the other factors that are there. And I think something we really have to learn from perhaps the presidential race on both sides, whether you watch Donald Trump and Ben Carson or, quite honestly, Senator Sanders on our side, is they're largely running against us. The way we operate in Washington, the way we don't operate in Washington is largely the message that is appealing to the public because they are tired of our inability to get together and actually have a budget process with appropriation bills that get done and we don't shut down government. But somehow the people within the Beltway on the majority party don't understand that. And I would just hope that as we look at something like this that's clearly not going to become law, but once again would show that you're going to repeal without replacing the Affordable Care Act, and millions of people would lose access to their health care, and once again put us closer to a government shutdown, is absolutely not what the public wants. And if you are looking for a speaker candidate, he is available, but he comes at a high price. So I'll yield back my time.
Mr. Pocan, Mr. Moulton, 2.5 minutes yielded, Mr. Moulton.
Thank you, Mr. Van Hollen. And thank you, Mr. Chairman. I'd like to start my time with a definition that we attribute to one of America's greatest scientists, Albert Einstein. Einstein said, "Insanity is doing the same thing over and over again and expecting different results." Were Einstein alive today, and he could witness the debate we are having on this reconciliation proposal, he would be able to see his definition of insanity in action. We are here today to debate and vote on a bill that would do the following things: attempt to repeal, defund, or otherwise undermine the Affordable Care Act for the 61st time, despite it being upheld by the Supreme Court. Attack, yet again, the right for a woman to choose where she receives her health care. And avoid, yet again, the misuse and abuse of the Overseas Contingency Operations Fund, which, in last year's House budget report, the majority stated was, quote, a backdoor loophole that undermines the integrity of the budget process. Therefore, it baffles me that at a time when we should be coming together to negotiate a plan to replace the damaging sequester and avoid a government shutdown, we are here debating a highly partisan proposal that will likely draw a challenge in the Senate and ultimately be vetoed by the President. What's the point? Americans would be better served if, instead of wasting our time on this futile crusade, Republicans would join Democrats in crafting a bipartisan deal that could move our country forward and avoid yet another government shutdown in December. I yield back.
Thank you, Mr. Moulton. I now yield 2 minutes to Mr. Yarmouth.
Thank you very much for yielding. I want to address the Planned Parenthood issue for a minute because we did this in the Energy and Commerce Committee, and I think there's some important points to be made. One is, if this Congress had disagreed with the issue of fetal tissue research, then they probably wouldn't have authorized it about 20 years ago. If Congress wants to reconsider that decision as to whether fetal tissue research is appropriate or not, we should do that. But we should not throw the baby out with the bathwater, and that is a pun that's intended. 97% of Planned Parenthood clinics don't do fetal tissue research, don't make tissue available for fetal research. I'm a former board member of Planned Parenthood in my district. My clinic in Louisville, Kentucky doesn't do abortions. So what this provision would do to my district is basically to deprive 5,000 people a year of their health care. And I know the argument is they can go to community health centers. Our community health centers already have waiting lists. Those 5,000 people would have nowhere to go. So let's talk about the issues separately. This bill really, in its impact, is to deny important, basic health care to literally millions of women throughout the and men throughout the United States. If you want to debate fetal tissue research, let's debate that separately. But again, let's not deny health care to millions of women because of that. I yield back.
Mr. Chairman, I just want to amplify on that. I mentioned earlier the statement that Mr. Chavitz made on national television indicating that after his investigations he found there was no evidence that Planned Parenthood had broken any laws. He was just asked and made a statement yesterday at a Judiciary Committee where he said, and I quote, did I look at the finances and have a hearing specifically as to the revenue portion and how they spend? Yes. Was there any wrongdoing? I did not find any. So this whole creation of special committees is clearly another witch hunt. We saw what happened with respect to Benghazi. There were committee hearings in the House and the Senate, the Defense Committee here, the Intelligence Committee here, Defense Committee, Intelligence Committee in the Senate. All of them looked at that very tragic, awful situation in Benghazi and found no wrongdoing. So what did we see in the House? When you didn't get the answer that you wanted politically, you created a special committee. And the majority leader of the House just said recently on national television, you know, that committee did its job. It brought down Hillary Clinton's poll ratings. We achieved our political result. Spending $5 million in tax money, taxpayer money, on a political witch hunt. And this Planned Parenthood Special Committee is the same thing. Again, all the committees of this House have looked at it, as have many states. Conclusion? They didn't break the law. No wrongdoing. What do? Create another special committee to look for a political answer that you want that is not there. So I would end these witch hunts. This really is, Mr. Chairman, this effort to repeal the Affordable Care Act. You know it's not going anywhere. I mean, the president's going to veto the bill. The effort to go after Planned Parenthood again, it's just not going to be successful. There's no finding of any kind of wrongdoing, and they provide essential health services. So what we really should be focused on is the business before this House, and that will be the subject of my next motion. So thank you.
Gentleman yields back. We will now proceed with reporting the Restoring Americans Healthcare Freedom and Reconciliation Act of 2015 to the House. Before we vote on reporting the bill, I want to remind members that the committee will follow its customary practice of considering up to 2 motions to request changes to the reconciliation bill at the Rules Committee after it is ordered reported. The clerk will report the title of the measure to be reported.
A bill to provide for reconciliation pursuant to Title II of S.Con. Res. 11, the concurrent resolution on the budget for fiscal year 2016.
I now recognize the gentleman from Indiana, Mr. Okita, for a motion to order the reconciliation bill reported to the House.
Thank you, thank you, Mr. Chairman. I move the Committee on the Budget order reported the Restoring Americans Healthcare Freedom Reconciliation Act of 2015 with the recommendation that the bill do pass.
Question is on ordering the Restoring Americans Healthcare Freedom Reconciliation Act of 2015 to be reported favorably to the House. All those in favor will say aye. Aye. Those opposed, no.
No.
Opinion of the chair, the ayes have it.
Mr. Chairman, I ask for a recorded
vote. A recorded vote is requested, and the clerk will call the roll.
Mr. Rokita.
Aye.
Mr. Rokita, aye. Mr. Garrett. Aye. Mr. Garrett, aye. Mr. Diaz-Balart. Aye. Mr. Diaz-Balart, aye. Mr. Cole. Aye. Mr. Cole, aye. Mr. McClintock. Aye. Mr. McClintock, aye. Ms. Black. Aye. Ms. Black, aye. Mr. Woodall. Aye. Mr. Woodall, aye. Ms. Blackburn. Aye. Ms. Blackburn, aye. Ms. Hartzler. Aye. Ms. Hartzler, aye. Mr. Rice. Aye. Mr. Rice, aye. Mr. Stutzman. Aye. Mr. Stutzman, aye. Mr. Sanford. Mr. Buchanan. Aye. Mr. Buchanan, aye. Mr. Womack. Aye. Mr. Womack, aye. Mr. Bratt. Aye. Mr. Bratt, aye. Mr. Blum. Aye. Mr. Blum, aye. Mr. Mooney. Aye. Mr. Mooney, aye. Mr. Grothman. Aye. Mr. Grothman, aye. Mr. Palmer. Mr. Palmer, aye. Mr. Molinar. Mr. Molinar, aye. Mr. Westerman. Mr. Westerman, aye. Mr. Van Hollen. Mr. Van Hollen, no. Mr. Yarmouth. Mr. Yarmouth, no. Mr. Pasquarel. Mr. Pasquarel, no. Mr. Ryan. Mr. Ryan, no. Ms. Moore. Ms. Moore, no. Ms. Castor. Ms. Castor, no. Mr. McDermott. Mr. McDermott, no. Ms. Lee. Ms. Lee, no. Mr. Pocan. Mr. Pocan, no. Ms. Lujan Grisham. Ms. Dingle. Mr. Liu. Mr. Norcross? No. Mr. Norcross, no. Mr. Moulton? Mr. Moulton, no. Mr. Chairman? Aye. Mr. Chairman, aye.
Are there any members who haven't voted or wish to change their vote? If not, the clerk will report.
Mr. Chairman, on that vote, the ayes are 21 and the noes are 11.
The ayes are 21, the noes are 11. The ayes have it, and the motion is agreed to. The Restoring Americans Healthcare Freedom Reconciliation Act of 2015 is ordered reported to the House of Representatives with a favorable recommendation. I note for the record that a quorum is present. I now recognize the gentleman from Indiana, Mr. Okita.
Mr. Chairman, I ask unanimous consent on the measure just reported that, number one, the chair be authorized to offer motions to go to conference and file any related conference report pursuant to Clause 1 of House Rule 22. Number two, that the staff be authorized to make any necessary technical and conforming corrections prior to filing the bill, such as inserting the short title of the bill. And number three, the motion to reconsider be laid on the table.
Without objection, so ordered. With the bill having been favorably reported to the House, I ask unanimous consent that the committee entertain up to 2 purely procedural motions relating to the type of rule that the committee will request from the Rules Committee. Debate on these 2 motions will each be limited to 20 minutes, equally divided, with 2 minutes reserved for the proponent to close, and the proponent and the opponent will each be allowed to yield time. Without objection, so ordered. Is there a motion?
There is, Mr. Chairman.
I recognize the gentleman from Maryland, Mr. Van Hollen.
Thank you, Mr. Chairman. I move that the committee...
Excuse me, I'm sorry. Clerk will report the motion.
A motion offered by Mr. Van Hollen. Mr. Van Hollen moves that the Committee on the Budget direct its chairman to request on behalf of the committee that the rule for consideration of the reconciliation bill make and order an amendment that would, 1, strike all of the underlying text, which is an irresponsible attack on women's health care in the Affordable Care Act, and 2, replace it with the text of H.R.3762, which calls for bipartisan negotiations to raise the discretionary spending caps for fiscal year 2016, or if those negotiations fail, raises the defense and non-defense discretionary caps by equal amounts to the President's requested level to allow appropriations actions to proceed and fund essential services at necessary levels.
Gentleman from Maryland, Mr. Van Hollen, is recognized for 8 minutes and then 2 minutes to close.
Thank you, Mr. Chairman. As I said at the outset of this committee markup, rather than working to repeal the Affordable Care Act for the whatever 61st time and roll back important protections for women's health, we really should be focused on some of the pressing issue of the country, including making sure that we don't see a government shutdown in the middle of December. And so what this motion does is say that we should adopt, make an order legislation to prevent the government shutdown. It would create a bicameral and bipartisan negotiating group to prevent the caps from continuing to erode military readiness and negatively impact our investment in our economy and education, scientific research. And if that committee is not able to accomplish that, it would keep the government open at funding levels necessary to accomplish those objectives. Very straightforward. Let's give the country peace of mind that we're not going to see a government shutdown in the middle of December. And with that, I yield 2.5 minutes to Mr. Ryan.
Thank the gentleman for the opportunity here. I want to just kind of go through this. I think, you know, we all know what's going on in Washington the last few days, and we know there's some big divides between the two parties. And I would just like to speak to how the budget kind of interfaces with what's going on out in the world. And we have these black and white arguments of all government or no government, and we all know, those of us who sit on the Budget Committee, that there is a very delicate interplay between the public investments that we are charged with making and private sector investments that can enhance and grow the economy. But they're both needed. And the budget is where the rubber meets the road. We have to do things here that the private sector can't do, or won't do, or doesn't want to do, or can't make money off of, because there's no profit involved. So we've got to make these public investments to help protect our people, but we also have to make public investments that are going to help grow the economy. And this budget under sequestration is devastating. And the reason why we don't see economic growth, we're not seeing the kind of job creation that we need to see, is because we're stumbling all over ourselves here. We've moved away from the strategy that we had in this country from post-World War II up until recent history, where the anti-government folks have, and many are in this room, have really shaped the narrative of the country. And so we see in this budget, for example, the cuts to education below the 215 levels, $2.8 billion. We see with infrastructure, $1.2 billion less than what the president wanted. Tiger grants that help. We have one in my district that just with $20 million led to $140 million in other investments from the other public entities and the private sector to create jobs. We hear about how vets can't get their health care. No one could make money off of providing health care to veterans, so the government had to step in and do it. We see the Republican bill provides $1.4 billion less than the president requested. So we'll have many people in Congress talking about how vets deserve the best, vets need health care, they're not getting their appointments in time, and here we have a budget, $1.4 billion. Cut to safety forces, cuts to the COPS program, cuts in public health. This is the kicker, and I'll yield back my time. $6.7 billion for innovations are being rescinded. This is in the healthcare delivery system. These investments led to a 17% decline in hospital-acquired conditions between 2010 and 2013, and we're gutting the very things that are saving lives and saving money. We need to wake up. I yield back.
Thank you, Mr. Ryan. Does anybody else on the committee want to say a few words on this? Yeah, Ms. Lujan Grisham.
Thank you. Hard to top my colleague, Congressman Ryan, about the issues that we're facing in terms of day-to-day life-saving health care, and coming from a district where we were one of the VA hospitals with the highest waiting lists and a whole series of other access issues, both in the new personal choice program and in the program before we initiated another $17 billion for VA services. But I just want to go back to the basics. I still represent one of the most impoverished states in the country. 22% of adults and 31% of children are living in poverty. It's the second highest rate in the nation. And at the same time, we're frankly fortunate to have 2 national labs, 4 military bases, and plentiful natural resources, which means that the federal government has a major presence in the state. As a result, frankly, no state depends more on Congress doing its job than my state. But New Mexico's been hurt over and over again. Frankly, we're crippled by congressional dysfunction. This indiscriminate, job-killing sequester cuts, short-term continuing resolutions, and the threat of continuing government shutdowns make it impossible, absolutely impossible for my state to recover. We can't grow its tax base. We can't create jobs. While the national unemployment rate is down to 5.1%, the rate is increased in my state to 6.7%. Government employment fell by 2,200 jobs since last year, and the construction industry has lost 2,000 jobs. Our contractors, all small businesses, mostly small businesses, they do everything from the most sensitive national security operations to routine maintenance of federal facilities. They're particularly vulnerable. This dysfunctional budget process creates uncertainty for these small businesses, and it's reduced their ability to invest and create jobs, and many of them have closed. On the non-defense side, because many New Mexico communities are impoverished, federal spending cuts have hit us particularly hard and has made it, as I said before, impossible to recover from the recession. Here's a stark example. More than 2/3 of children come from low-income families. Nearly a quarter of New Mexicans rely on SNAP. During the past year, we've seen a 19% increase in SNAP cases at a time when sequestration again threatens drastic cuts. I think we should govern responsibly. We should pass a timely budget that makes targeted investments, lifts families like the ones I represent out of poverty, and create jobs. I support this motion because it forces my Republican colleagues and Democrats to work to repeal the sequestration, which has harmed so many New Mexicans and so much of this country. I yield back.
I thank my colleague, and just in closing would say that the Congressional Budget Office has told us, the Budget Committee, that these sequester levels of investment in defense and non-defense are slowing down economic growth over the next couple years. And I can't imagine why we would deliberately do something that actually slows down economic growth in this country. So let's pass this legislation, get rid of the uncertainty, provide stability and economic growth. Thank you, Mr. Chairman.
Thank you, gentlemen. Gentlemen will be recognized for 2 minutes after the majority rebuts the points made on this motion, and I claim the time in opposition. This motion really has nothing whatsoever to do with the underlying bill. It doesn't meet the requirement of the reconciliation instructions. The reconciliation instructions require that the committees of jurisdiction find at least $1 billion in savings, in direct savings, mandatory savings. Those are the committees of Ways and Means, Energy and Commerce, Education and Workforce. This motion does not do that. Instead, this substitute would in fact raise the deficits by billions of dollars and includes policies that stray far beyond the jurisdiction of the underlying committee. So this motion really is not a reconciliation bill, and I urge my colleagues to oppose the motion. I'm pleased to yield 2 minutes to the gentleman from Georgia, Mr. Woodall.
Thank you, Mr. Chairman. I'm glad you took the motion on terms of its merits there, that it has no place here. I was going to take it on from an emotional perspective because I can't count. I lost count here of how many times folks have talked about we need to come together, work together, and craft a solution. And what does this motion do? It takes the biggest bipartisan agreement we've passed in the 4.5 years that I've been in Congress and calls on us to come together and renegotiate that because folks don't like the deal they got. Then it says if we can't come together and renegotiate the biggest bipartisan deficit reduction deal in the history of the United States of America, let's just quit and raise spending for everybody. It is unbelievable. This is the Budget Committee, for Pete's sakes. This is a bipartisan committee with thoughtful people on both sides of the aisle, and our idea of progress is to talk about working together, but then to come back and try to undo the deal we did last time we worked together. Folks, if we're going to do this, it's going to be hard. It's going to be hard, and it's going to gore everyone's ox. We're getting to the hard part now. Voting to do something together in August 2011, that was the easy part. Coming together now and sticking with what we agreed to do in 2011, that is the hard part. And this motion begins the process of unraveling all of that bipartisanship. We can do better than that, Mr. Chairman, and we must do better than that. I urge rejection of this motion, and I yield back.
I thank the gentleman. I'm pleased to yield 2 minutes to the gentleman from Alabama, Mr. Palmer.
Thank you, Mr. Chairman. Contrary to claims that Obamacare is compassionate, the health care law further entrenches a superstructure that penalizes work and encourages dependence for a wide range of Americans. We see the negative effects of this enormous new government bureaucracy that restricts freedom and imposes unnecessary burdens on the American people. And while everyone can agree that we must reduce the cost of health care and remove the barriers to access, Obamacare is definitely not the solution. It's time for Congress to repeal it. This substitute would leave all of the most damaging provisions of Obamacare intact, including the individual mandate, which coerces Americans to purchase a private product that they may not want, need, or can afford to pay for. And it creates an individual mandate penalty. A lot of people experienced that when they file their taxes this year. Obamacare requires employers with 50 or more full-time workers, defined as a minimum of 30 hours a week, to either offer government-approved health care or pay a penalty. As a consequence, thousands and thousands of companies have refused to hire that 50th employee. There's a huge amount of evidence that employers are cutting workers' hours to fall below the 30-hour threshold. In the first 9 months of last year, nearly 5 million people were no longer receiving employer-sponsored coverage. The medical device tax, which has resulted in employment reductions of 14,000 workers in that industry, and has already been repealed by the full House on a bipartisan basis in the last 3 Congresses. And the Independent Payment Advisory Board, which allows an unelected board of 15 bureaucrats to slash provider reimbursements and restrict seniors' access to health care. The gentleman, Mr. Rice from South Carolina, made the point about how Obamacare and other regulations are harming our economy. I just want to point out, Mr. Chairman, that last year, regulations cost the economy over $2 trillion. It has a disproportionate impact on small business. Large business was paying an average of $7,700 per employee for regulatory costs. Small business was paying nearly $12,000. Small business is the single largest provider of jobs in this country, and we're killing small business. As Mr. Rice pointed out, last year there were, he didn't give the number, but there were 70,000 more companies closed than started. That's the first time since 35, during the Carter administration. Prior to that, in 2008, there were 100,000 more businesses started than closed. We no longer rank in the top 10 in the world among entrepreneurs. I reject this. I speak against this motion and urge that it is rejected.
I thank the gentleman. Please yield 2 minutes to the gentlelady from Missouri, Ms. Hartzler.
Thank you, Mr. Chairman. This bill, this motion is not germane. It does not. I mean, it does assert that it's going to increase defense spending, and I share that goal. Many of us do, and that's exactly why the Republicans passed a 2016 budget that provided for a robust level of spending for our men and women in uniform, ensuring they would have the resources needed to defend this nation. In fact, the budget provided the same amount of defense spending that the President requested. Both the House and the Senate have now passed the National Defense Authorization Act, despite the no votes from almost everybody on the other side of the aisle here who is offering this amendment. Now, if my colleagues wanted to support our national defense, they could have done it last week by voting for the NDAA. And if the President, our Commander-in-Chief, wants to support our national defense, he won't veto it like he is saying that he is going to. But today we have a chance to help Americans being hurt by the Unaffordable Care Act. It is increasing cost, reducing access, and hurting jobs. And I have just a few examples from people in my district. We have the Hickory County Courthouse talking about how their health insurance costs are going up. Their employees are going to see and are seeing between 20 and 60% increase in premium costs with higher deductibles, and out-of-pocket costs. Another county reports the rate of the county increasing their insurance premiums by 24%. Just this week, I got 2 emails from home. And Mike, who's a business owner, said that we received our health care renewal from this insurance provider for the upcoming year. Our renewal reflects a 36.2% increase. And he talked about how difficult it was to stay in business and how discouraging it was. And lastly, I got an email from Joni and Don that I met at the Cass County Farmers Market a couple weeks ago. And they said since Obama careless, as they called it, insurance policies, our biggest cost now in their whole budget is insurance premiums. They say now they're paying 2.5 times the amount they're paying for their house payment just for their insurance, and 3 brokers gave them bids. One of them had a $12,000 per year deductible. Obamacare is hurting people. That's why I urge the defeat of this motion and support of our underlying bill. I yield back.
Thank the gentlelady, and I thank my colleagues for their observations on the non-germane nature of this motion, but also on the issue itself. And let me just address a couple points that have been made by some of our friends on the other side of the aisle. There's been concern expressed about this reconciliation bill removing the pre-existing illness exclusion. It doesn't address that at all. It's not included, so you can be note that there is no change under the pre-existing condition exclusion. I want to also talk about the concerns that some folks on the other side of the aisle have about the fact that replacement isn't included here. And you're right, it isn't, because you can't include a replacement bill in a reconciliation bill. It's just, it's not allowed by the rules of reconciliation. Fact of the matter is, we have all sorts of great ideas for patient-centered health care to replace Obamacare with a system that actually respects patients and respects families and their physicians. And then I want to briefly address this notion that was put forward by one of our friends on the other side, that the economy is currently struggling because of the Republican budget. Give me a break. The fact of the matter is, this economy is struggling right now because of the policies coming out of this administration. The fact that the administration is wedded to high taxes for both businesses that then can't create jobs, and for individuals who then have extreme difficulty realizing their dreams, putting forward the kinds of programs that they believe are most appropriate. We've seen growth rates just over the last 3 years, the projection for growth rate to come down from 3% over the next 10 years to 2.9 to 2.5 and now 2.3%, and that's due to the Republican budget? Please. The regulatory oppression coming out of this administration is what's causing the economy to be in the doldrums. You know it, we know it, and we urge defeat of this motion, adoption of the Republican motion, and I now recognize the gentleman from Maryland for 2 minutes to close.
Thank you, Mr. Chairman. I don't have time in the 2 minutes to show that the inaccuracies in the statements that were made about the Affordable Care Act, except I do want to make this point. It's true you're not using this legislation to provide your alternative on health care, but the reality is this House of Representatives has not passed through the regular order any piece of legislation to replace the Affordable Care Act. Despite years and years of telling us that you're not just going to eliminate, but you're going to replace. So go ahead and use the regular order, but that hasn't been done. Secondly, the one thing I do agree with you on is that this motion, to make sure that we keep the government up and running, does not have anything to do with the underlying bill. Because what the underlying bill is doing is wasting the time of this institution to try to repeal the Affordable Care Act for the 62nd time, something that you know is a futile exercise. You know the president's going to veto this. And at the same time, if it was successful, would take away affordable health care to over 16 million Americans. Now, just to Mr. Woodall's point, it's interesting that here in the Budget Committee you would make that argument when, as you well know, the way that our Republican colleagues funded defense by essentially raiding the OCO fund was, in the words of this own committee, just last year, a violation of the budget process. So if we really want to do what Ms. Hartzler said we should do, increase defense, let's also increase our investment in essential things like education and research at NIH. Let's get together and figure out a way to do it. But if we can't come to agreement, and you're having trouble agreeing on who your leadership is going to be, so if we can't come to agreement on a negotiated way to keep the government open, let's at least have this fail-safe mechanism that tells the American people we're not going to have a shutdown in the middle of December and we're not going to hurt the economy. So I urge everybody to support this motion.
Thank you, gentlemen. The question is on agreeing to the motion offered by Mr. Van Hollen. All those in favor will signify by saying aye. Aye. Those opposed say no. No. Opinion of the chair, the noes have it. Gentleman requests a recorded vote, and the clerk will call the roll.
Mr. Rokita? No. Mr. Rokita? No. Mr. Garrett? No. Mr. Garrett? No. Mr. Diaz-Balart? No. Mr. Diaz-Balart? No. Mr. Cole? No. Mr. Cole? No. Mr. McClintock? No. Mr. McClintock? No. Ms. Black? No. Ms. Black? No. Mr. Woodall? No. Mr. Woodall? No. Ms. Blackburn? Ms. Blackburn? No. Ms. Hartzler? Ms. Hartzler? No. Mr. Rice? Mr. Rice, no. Mr. Stutzman? Mr. Stutzman, no. Mr. Sanford? Mr. Buchanan? Mr. Buchanan, no. Mr. Womack? Mr. Womack, no. Mr. Bratt? Mr. Bratt, no. Mr. Blum? Mr. Blum, no. Mr. Mooney? Mr. Mooney, no. Mr. Grothman? Mr. Palmer? Mr. Molinar? Mr. Molinar, no. Mr. Westerman? Mr. Westerman, no. Mr. Van Hollen? Mr. Van Hollen, aye. Mr. Yarmouth? Mr. Yarmouth, aye. Mr. Pascal? Mr. Pascal, aye. Mr. Ryan? Mr. Ryan, aye. Ms. Moore? Ms. Moore, aye. Ms. Castor? Ms. Castor, aye. Mr. McDermott? Mr. McDermott, aye. Ms. Lee? Ms. Lee, aye. Mr. Pocan? Mr. Pocan, aye. Ms. Lujan Grisham? Ms. Lujan Grisham, aye. Ms. Dingle? Mr. Liu? Mr. Liu, aye. Mr. Norcross? Mr. Norcross, aye. Mr. Moulton? Mr. Moulton, aye. Mr. Chairman? Mr. Chairman, no.
Any member wish to change their vote, or any member who hasn't voted? If not, the clerk shall report.
Mr. Chairman, on that vote, the ayes are 19, the ayes are 13 and the noes are 19.
The ayes being 19, the noes being 13, the noes have it, and the motion is not agreed to. Is there another motion?
Mr. Chairman, I have a motion at the desk.
The clerk will read the motion.
A motion offered by Mr. Rokita. Mr. Rokita moves that the chairman of the Committee on the Budget be provided the discretion to request the Committee on Rules report a rule that would make an order an amendment to the Restoring Americans Healthcare Freedom Reconciliation Act of 2015 as reported.
I recognize Mr. Rokita for 8 minutes, and he will have 2 minutes to close.
Thank you, Mr. Chairman. This is a very simple motion, in my opinion. It reaffirms the prerogative of the chair to request a rule making a possible future amendment in order. Although this amendment does not offer any substantive policy change to the underlying bill, it has been necessary in the past to amend reconciliation bills, and we must be prepared, frankly, for any contingency. There are a number of reasons that these bills get amended, whether it's for technical changes in complex legislation, which is so often the case, or it needs to meet one of the many House or Senate budget rules. I don't want to take the entire 10 minutes. I believe my colleagues did a wonderful job explaining all the ways that Obamacare is harming our economy, our middle class, and our healthcare system. So with that, Mr. Chairman, I reserve.
Gentlemen will yield.
Yield.
It's important just to, I think this motion is a very general motion, but I think it preserves the Budget Committee's authority, regardless of who is the majority party, to provide for the Rules Committee a recommendation for any changes to a reconciliation bill as it comes through the process. Everybody knows who's looked at reconciliation bills in the past, these changes have been made at the Rules Committee. And because the Budget Committee is precluded from making any changes to the reconciliation bill, that's the process by which the Budget Committee is able to then affect any particular changes that might be desired by the committee or by the conference. So it's a very simple motion, and I think it ought to be able to be supported by all because it protects the Budget Committee's prerogative, and I yield back to the gentleman.
Thank the chair, and I reserve. I yield back.
Gentleman yields, and the gentleman from Maryland is recognized for 10 minutes.
Thank you, Mr. Chairman, and I'm going to oppose this motion, and here's the reason why. Is I think everybody on this committee knows it's the right of any member of the Congress to go before the Rules Committee and make any motion and request to the Rules Committee. So, number one, it's unnecessary, but our concern is that in voting for it, it suggests that we're providing a blank check to whatever recommendations the majority would make to the Rules Committee. We just made our recommendation as to what motion we should make to the Rules Committee, which is to prevent the government shutdown in mid-December and create a process for doing it. We're not going to give sort of a go-ahead. You clearly rejected that motion. We're not going to sort of tacitly give our consent to whatever motion that you may make on behalf of the majority in the committee to the Rules Committee. So we're going to oppose that, and I yield 2.5 minutes to Ms. Moore.
Thank you, Mr. Ranking Member. And you know, the chairman and vice chairman, good friends of mine, really went through a great deal, spent a great deal of time explaining how this is kind of an empty motion, futile motion, and it's just an embarrassment, not just to the so-called governing party, but to all of us here in the House. You know, this month has been like deja vu all over again. Since September 18th, the House has voted 4 times to defund Planned Parenthood. 6 in 10 Americans don't want Planned Parenthood defunded. To eliminate Medicaid reimbursement for abortion providers and otherwise restrict access to safe and legal abortion, although it's our constitutional rights as women to control our own bodies. We voted last week to give flexibility to states to exclude abortion providers from Medicaid funding, and we also had a kangaroo court. We established a kangaroo court, the Select Committee to Attack Women's Health, to find evidence that doesn't exist, and even the chairman, Chavez, has admitted that there's just no evidence. There's no there. And yet this continuous and obsessive attack on Planned Parenthood is a not so truly veiled attack on low-income women's health. Just look at the facts. 78% of Planned Parenthood patients are at or below 150% of the poverty level. 41% of low-income women consider their OBGYN their primary care source to be Planned Parenthood. And we're not just prohibiting Planned Parenthood funding for 1 year with this motion. We're also, once again, repealing vital parts of the Affordable Care Act. This is the 61st vote to repeal or undermine the Affordable Care Act. And by doing so, we're increasing the numbers of uninsured up to 15 million and increased premiums in the individual market about 20%. And you guys just refuse to admit that since the ACA enrollment began, uninsured population has decreased by 35%. 17.6 million uninsured Americans have gained health insurance, and 129 million Americans with pre-existing health conditions, including 17 million children, no longer have to worry about being denied coverage or denied higher premiums due to their health status. Folks, colleagues, this is not a game show. This isn't a competition for how many people we can throw under the bus. There's no prize to be won by these futile exercises. You know it's never going to be law. It's just, you know, this is just a production and just a tantrum to undermine women's health, and I yield back.
Well, I thank the ranking member and thank the chairman for the hearing. First, I want to start by saying it's very unfortunate that the Van Hollen motion was voted down. That was the most constructive path to avoiding a government shutdown that is looming in December and forcing us and the Congress to come together and work on a budget agreement. Thank you, Mr. Van Hollen, for that very constructive proposal. This is creating great economic uncertainty. Back home, I represent a district with an Air Force base that is home to U.S. Central Command and Special Operations Command. They are beside themselves about the inability of the Congress to move forward with a reasonable budget plan. It is now complicating the military missions of our country. They don't want another CR. That's a dead end. They don't want an OCO gimmick that doesn't serve our country well. They want those monies in the base defense budget and have spoken out loudly. And then on the domestic side, our medical researchers, transportation and infrastructure, all of those important jobs that help lift America are also being undercut by the uncertainty created here in the Congress. Now, I'm very happy this is being done in an open setting today because it really lays bare the priorities of the two parties here in Congress. The Democratic priority is to address the budget uncertainty, come together, work out a plan to move forward and avoid the government shutdown. The Republican priority, however, is to continue to attack women's health care and intimidate Planned Parenthood, nonprofit clinics, and the women that go there for their health services. This witch hunt continues, and it's not serving the interest of our great country. It's beneath the dignity of this Congress. Because what is going to happen when we come back after next week? There is a new Benghazi-like select committee to continue this witch hunt. I mean, this is really an all-time low. There's been an attack on women's health now for decades. But now the all-time low is what happened this summer with these manufactured YouTube videos now becoming the basis of public policy in America. While all the investigations done here in the Congress and in states across the country have demonstrated no wrongdoing whatsoever, so we're going to waste taxpayer funds and important time on this witch hunt. I think it's very unfortunate. You know, the approval ratings of Congress are at an all-time low, and I have to say this demonstrates why that is, because this Congress and the so-called governing party is not focused on the priorities for our great country. Instead, focused on intimidating women in trusted clinics across the country. I urge a no vote on this motion and on the reconciliation package. Thank you.
Thank you. There we go again for the 62nd time. President Ronald Reagan used that over and over again. There we go again. When I was elected to this position, the members of my district would say over and over again, we want you to go down there and help fix the system. The chairman just admitted the budget has nothing to do with the economy. And certainly what we're doing today has nothing to do with putting the men and women back to work. Our constituents want us to do our job. Do your damn job. But what we have here is a complete farce. Many of the members from this room also sit on armed services, where we heard the leadership, the generals come to us and say, we need predictability. We can't plan on this. Yet, what are we doing today? We're doing exactly that. Just making work. This is not doing our job. I heard the term bipartisan. There has never been a vote since I've sat on this panel where one member of the other party voted for the other motion or underlying bill. Not once. That's not bipartisanship. That's not working together. All we're doing is falling back into our holes of where we are, making no effort to come together, and I think the American people are disgusted with it, as I am. I came here to do a job, and what we're doing today is just, again, talking about how you're going to take health care services away from the most needy people who need it. You know, this is exactly what's wrong with Congress, is what's going on here today. There's no chance of this bill ever making it to law, yet we're wasting our time here. And I think the American people really need to see what's going here. And I urge our members to take a look real closely to see how dysfunctional this committee and this Congress is. And I urge us, once and for all, let's come together and try to actually do something instead of just putting our talking points out. I yield back my time. Thank you.
Thank you, Mr. Norcross, and thank you for summing up today when we should be working on pressing issues for the American people, keeping the government open, running, investing in the economy. We're here for the 61st time, I think, trying to take health care away from over 16 million Americans and defund women's health care programs. We can do better. Thank you, Mr.
Gentleman's time has expired. The gentleman from Indiana is recognized for 2 minutes to close.
Again, I thank the chair. You know, the reason we're here today is because of the extraordinary leadership of the members of the majority of this committee, along with the U.S. Senate, who's got us to a reconciliation place that we haven't been frankly, properly since 2001. And now we have a chance to continue reducing our deficits, work on our debt, and get to some policy provisions that are sorely needed in this country. I think we need to do more of it. As to my friend Ms. Moore's contention about women's health care, I would remind the committee members that in this underlying bill, we actually increased spending on women's health care, $235 million in fiscal year 16 and 17 to be spent on community health centers. Now, with respect to my motion, again, I think that because this process hasn't happened every year in quite some time, that we as a budget committee ought to preserve our say in the process going forward, and that's what this motion does. I urge committee members and all of them to support it wholeheartedly, and I yield back.
Question is on agreeing to the motion offered by Mr. Rokita. All those in favor will signify by saying aye.
Aye.
All those opposed say no. Opinion of the chair, the noes have it, and a recorded vote is requested, and the clerk will call the roll. And the clerk, we may have to wake up our members first, so clerk will call the roll.
Mr. Rokita?
Aye.
Mr. Rokita? Aye. Mr. Garrett? Aye. Mr. Garrett? Aye. Mr. Diaz-Balart? Aye. Mr. Diaz-Balart? Aye. Mr. Cole? Aye. Mr. Cole? Aye. Mr. McClintock? Aye. Mr. McClintock? Aye. Ms. Black? Aye. Ms. Black? Aye. Mr. Woodall? Aye. Mr. Woodall? Aye. Ms. Blackburn? Aye. Ms. Blackburn? Aye. Ms. Hartzler? Aye. Ms. Hartzler? Aye. Mr. Rice? Aye. Mr. Rice? Aye. Mr. Stutzman? Aye. Mr. Stutzman? Aye. Mr. Sanford? Mr. Buchanan? Aye. Mr. Buchanan? Aye. Mr. Womack? Aye. Mr. Womack? Aye. Mr. Bratt? Aye. Mr. Bratt? Aye. Mr. Blum? Aye. Mr. Blum? Aye. Mr. Mooney? Aye. Mr. Mooney? Aye. Mr. Grothman? Aye. Mr. Grothman? Aye. Mr. Palmer? Aye. Mr. Palmer? Aye. Mr. Molinar? Aye. Mr. Molinar? Aye. Mr. Westerman? Aye. Mr. Westerman? Aye. Mr. Van Hollen? No. Mr. Van Hollen? No. Mr. Yarmouth? No. Mr. Yarmouth? No. Mr. Pascal? No. Mr. Pascal? No. Mr. Ryan? No. Mr. Ryan? No. Ms. Moore? No. Ms. Moore? No. Ms. Castor? Ms. Castor? No. Mr. McDermott? No. Mr. McDermott? No. Ms. Lee? No. Ms. Lee? No. Mr. Pocan? No. Mr. Pocan? No. Ms. Lujan Grisham? No. Ms. Lujan Grisham? No. Ms. Dingle? Mr. Liu? No. Mr. Liu? No. Mr. Norcross? No. Mr. Norcross? No. Mr. Moulton? No. Mr. Moulton? No. Mr. Chairman? Aye. Mr. Chairman? Aye.
Any members wishing to vote or change their vote? If not, the clerk will report.
Mr. Chairman, on that vote, the ayes are 21 and the noes are 13.
The ayes being 21 and the noes being 13, the ayes have it, and the motion is agreed to. I want to remind members that each member, and I know some folks were not here for the first vote, that each member has until the close of business today to add any statement to the record regarding this hearing. This completes the consideration of the Restoring Americans Healthcare Freedom Reconciliation Act of 2015. The committee stands adjourned.